I would now like to turn our attention to team membership, specifically membership types, responsibilities, and strategies for being an effective team member. We highlight this because there will be many instances where you're a team member, not a leader. And additionally, it's often said that the best leaders were also the best team members. So team members also have vital responsibilities, functions, and are characterized just as leaders are. And by characterize, I mean that there are several different membership frameworks, just as there are different leadership frameworks. And we will review one in this segment. Core team member responsibilities include a focus on and support of achievement of shared goals, performing your role willfully and skillfully, stating concerns when you have them, holding yourself accountable for your actions, and actively engaging with the team and leader. So recall at the beginning of this module, I defined designated versus situational leaders. Another term for situational leaders is emergent leader. To recap, designated leaders are those in a recognized leadership position, whereas an emergent leader can be any team member who steps up to lead, depending on the situation, their skills, and needs of the patient and team, regardless of whether he or she has a designated leadership position. Emergent leaders have an awareness of when to step in and lead and when to step back. Cycling provides an analogy. During a race, different cyclists on a team step up and lead depending on their strengths and the circumstances at the moment. Here is one membership framework from an article by Gibbons and Bryant published on the BMJ Careers website. It defines 5 styles of team membership along 2 dimensions. One dimension relates to the degree of engagement, active versus passive, and the other relates to independent thinking, independent critical thinking versus dependent uncritical thinking, shown here on the bottom. Let's walk through these. Passive members are those not actively engaged with the team or task and who do not use independent critical thinking. They need constant motivation and direction, which can really drain everyone around them. Conformist members are those who support the team goals and are actively engaged, but don't use critical thinking to appraise the what or why of what they're doing. They essentially always support the team and its leader and don't question anything. And they also will not make independent decisions without guidance from others. On the other hand, alienated members have high levels of critical thinking but are disengaged from the group. They tend to focus on why things won't work or don't work. They may actually have some good ideas but tend not to present them. All taken together, these behaviors can undermine the team and leader. Leaders and teams have to carefully manage people with this style, which can really lead to distraction and inefficiencies. In contrast, the exemplary member will apply constructive critical thinking and actively interact with the team and leader. If they agree on a course of action, they wholeheartedly support it, but if they don't, they'll challenge it and offer constructive solutions. And lastly, some folks are pragmatists who move between the boxes during the course of a task. Let's now focus on strategies that exemplary members use. These strategies include actively seeking information, questioning ambiguous or difficult situations, giving specific, timely input in a clear, straightforward manner. They don't wait until the situation gets worse. They request briefings when needed, take initiative and handle situations as needed, exhibit flexibility in response to situational demands, and maintain and employ situational awareness. Situational awareness is continual monitoring and responsiveness to evolving conditions, which we'll discuss further in the next segment. As shown in the Just a Routine operation video, when things begin to fall apart, all of these things above, all of these strategies are even more critical, questioning things, stating concerns, and offering to help. So the key learning points are that team members have vital responsibilities towards successful collaboration. There are general categories of ways team members engage with their teams. Effective team membership involves constructive critical thinking and active engagement. And finally, there are specific practical tactics for members to maximize collaboration and positively impact patient care, including knowing when to step up and lead and then actually doing it. So for this segment's forum discussion question, consider, does your team membership style change depending on the situation? And if yes, why and how?